My name is Nicolaou. I'm the Regional Account Director working in East Anglia on behalf of Takeda UK, and I've been in that role for the last 6 years. Well, a lot's changed since 2005, both internally and externally. The NHS itself, as you know, has become a much more complex place, and there's a much more diverse range of customers and organisations to deal with. Internally for Takeda, we've gone from back in 2005 having to manage 2 products to 6 promoted products now, and with another 3 on the way imminently. So that in itself presents several challenges, and those products are going to be in a much more diverse range of therapeutic areas and going from primary care into the specialist domain as well. So that in itself brings, as I said, a number of challenges, but also back in 2005 we had very little support structure in place in Takeda, and the RAD was essentially on their own in their region. But now we do have a very complex and comprehensive support structure from Takeda centrally, and the RAD acts as the interface and being able to bring those support functions into play on their regions when and if they're necessary. Well, I think it's fair to say that there really isn't a typical day as a regional account director. Because of the hugely diverse range of customers that we see within the NHS, every day is incredibly varied. So I could be sitting down and talking with board level customers from a CCG, including chief executives and finance directors around a particular project. I could be then meeting with GPs and nurses at the other end talking about the implementation of a project. And then there's also the more clinical and data-centred interactions with specialists within secondary care. So it really is incredibly varied, and that's one of the beauties of the RAD role, is that it's ever-changing and always interesting on a day-to-day basis. And then there is also the fact that we are increasingly being asked to input into central projects within Takeda as well, so taking the learnings and the experiences that we have in the field and feeding them into the wider organisation. Well, I think, as I mentioned earlier, it's firstly the incredibly varied nature of the job. It really is different every single day, and I think most people within the role would say that that's a real bonus compared to potentially a role where you're doing the same thing day in and day out. There is no day that's repeated usually as a regional account director, so that's hugely appealing. And it's also engaging with that wide variety of different stakeholders within the NHS and having different levels of conversations, and through that being able to add value to their work and being able to positively impact on patient care. That's very rewarding at the end of the day as well. And I'd also say just being accountable and visible in terms of the work that you do, and then being recognised and rewarded for that when the results are achieved, is also highly motivating for people that are very results orientated and driven. Well, I think with most people working around the NHS, it has been the degree of change that's been implemented recently. The CCGs are still finding their feet, and for us, being able to find the right people with the right responsibilities is a challenge in itself, and therefore being able to have some meaningful dialogue with them. And that really does link back to what I mentioned earlier about us really having to fully understand the NHS environment and really getting underneath its skin, and therefore allowing us to have that kind of deeper conversation with our customers. There's also obviously the economic pressures that are going on at the moment, and the NHS's unprecedented need to save money. And in general, the Takeda value proposition does support that, because the Takeda products support the QIP agenda and cost improvement plans. And then there's obviously the challenge of the ever-expanding Takeda organisation internally. We've recently integrated Nicolaou through an acquisition, and that's led to a very healthy pipeline of products and a varied portfolio of products. And what that means is that we have to really focus on prioritisation of different parts of that portfolio according to the different needs locally and the value that can be delivered by those products. So there really is a number of challenges that we're having to deal with, but it's all about linking that back to our own internal strengths and capabilities and managing that through our account plans. Absolutely. I mean, we all know that this has been probably the biggest change in the NHS since its creation in 1948. And it's not just, as we've spoken about before, the creation of so many new roles and stakeholders and leaders within the NHS, but it's also about thinking about breaking down the siloed budgets and financial flows within the NHS that have existed in the past. So through the role that I have and the other RADs within Takeda, we can help the NHS to save money, not just through direct drug acquisition costs, but also through pathway savings, through the understanding that we have of the patient journey and how perhaps that could be modified going forward. So it's really, really important to stay abreast of the ongoing changes within the NHS, because who knows what's going to change next year and beyond, and what impact that might have on the business going forward, particularly, for example, if there's another government change in the next 2 years or so. Well, first and foremost, I'd say really develop your account management skills, because as I said before, that really is the cornerstone of how we work, and that really needs to be at the top of the game to be successful as a RAD. I'd also say to really delve into the inner workings of the NHS and how the different customer groups and organisations impact on your business, and be absolutely confident with that. And finally, I'd just say be absolutely honest with yourself about your own development needs and where potentially you could build on the skills and expertise that you already have, because by showing that level of awareness, you're not only going to develop, but you're going to show your own organisation or future organisations that you have that mindset of being able to continually improve and accurately assess your own competencies.